Nails, one thing you can get into shape without exercise. Let's start with nail disorders. Nail disorders is a condition caused by injury or disease of the nail unit. You can tell clients that they may have a disorder and refer them to a physician if required. You can cosmetically improve certain nail plate conditions if the problem is cosmetic and not a medical condition or disorder. Eggshell nails. Throughout the slide, you will see some letters are highlighted in red, and I like to take a smaller word from the actual term and relate it to something in the definition. So can we honestly say that most eggs are white? Eggshell nails are noticeably thin white nail plates that are more flexible than normal, weaker, and can curve over the free edge, usually caused by improper diet, hereditary factors, internal disease, or medication. Be very careful when manicuring these nails because they are fragile and can break easily. Use the fine side of an abrasive board 240 grit or higher to file them gently, but only if needed. You may have a question on your written exam asking what number grit is suggested for a guest that has eggshell nails, and your answer selection could be 180 grit, 300 grit, 240 grit, or 400 grit, just as an example, and your answer would be 240 grit. Bows lines. I like to hug my bow horizontally. Are visible depressions running across the width of the natural nail plate. They usually result from major illness or injury that has traumatized the body, such as pneumonia, adverse drug reaction, surgery, heart failure, massive injury, or a long-lasting high fever. Next we have hangnail, also known as AGNAIL, and they hurt like hell. This is a condition in which the living skin around the nail plate splits and tears. Dry skin or small cuts can result in hangnails. Hot oil manicures will aid in correcting the condition. Also, never cut the living skin around the natural nail plate even if it's dry and rough looking. You may have a question, what manicure is suggested for a guest that has a hangnail or hangnails? A hot oil manicure. Signs of infection are redness, pain, swelling, or pus. And remember, they hurt. They hurt when you pull that little piece of skin. It always turns into something big. Leukonychia. I like to remember this. I got milk spots on my nails. Leche, milk in Spanish, also known as white spots, are whitish discolorations of the nails, usually caused by minor injury to the nail matrix. They do not indicate disease. As the nail continues to grow, the white spots eventually will disappear. Melanonychia, like in hair color, melanin, is darkening of the fingernails or toenails. It may be seen as a black band within the nail plate extending from the base to the free edge. The reason why melanonychia is classified as a disorder and not a disease is because all of our body organs are associated with the palms of our hands and the soles of our feet. So when you get a chance, look up reflexology and see what challenges this guest is having in this picture here of their third, fourth, and fifth toe. It might be their sinuses. ONYCHOPHAGY, chop, 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 aka bitten nails, is the result of a habit of chewing the nail or the hardened, damaged skin surrounding the nail plate. Advise clients that frequent manicures and care of the hardened eponychium can often help them overcome this habit, improving the health and appearance of the hands. The application of nail enhancements can beautify deformed nails and discourage the client from biting the nails, should not be treated by a cosmetologist. ONYCHORRHEXIS, I split from my ex. You can remember it this way, or you can also add the H in, hex, and say a witch put a hex on you and now your nails are split and brittle and they will never grow. So the definition of ONYCHORRHEXIS is split or brittle nails that have a series of lengthwise ridges giving a rough appearance to the surface of the nail plate. usually caused by injury to the matrix, excessive use of cuticle removers, harsh cleaning agents, aggressive filing techniques, or heredity. ONYCHORRHEXIS can be corrected by softening the nails with a conditioning treatment. Plicature nails. Cats. If anyone has a cat and you press their tops of their claws, their nails come out and they're highly curved. AKA folded nail is a type of highly curved nail plate, usually caused by injury to the matrix, but it may be inherited. This condition often leads to ingrown nails. Nail pterygium, I hear the word gem, stretched, is an abnormal condition that occurs when the skin is stretched by the nail plate. This disorder is usually caused by serious injury, such as burns or an adverse skin reaction to chemical nail enhancement products. It is abnormal and caused by damage to the eponychium or hyponychium. Now we have to know the difference between the eponychium and the hyponychium, and I feel the hyponychium is the easiest. So if you take one nail and poke it under the other nail or the opposite finger and you feel that pain, that's a hyponychium. That's a live skin under the free edge. If some of you are receiving a nail service, acrylic nails, and you feel like a burning sensation after your nail service is complete, your nail might look like this in a couple of years. So check with that nail salon to make sure that they're not using MMA. That is a prohibited product. They should be using EMA, so be aware. Ridges. I lost my B to bridges, so now everything is vertical. Used to be horizontal. Are vertical lines running down the length of the natural nail plate that are caused by uneven growth of the nails, usually the result of normal aging. Older clients, when manicuring a client with this condition, carefully buff the nail plate to minimize the appearance of these ridges. Ridge filler can be used with nail polish. Splinter hemorrhages are caused by physical trauma or injury to the nail bed that damages the capillaries and allows small amounts of blood flow, associated with some type of heart impact or other physical trauma to the fingernail or toenail. Now, normally when we hear the word hemorrhage, we think of blood. So there's just a little teeny blood when you see a splinter hemorrhage. Pseudomonas aeruginosa is a typical bacteria infection on the nail plate that can be identified in the early stages as a yellow-green spot that becomes darker in its advanced stages. One of the several common bacteria that can cause nail infections or Staphylococcus aureus. So back in the day, we would just call this like a mold or a fungus, and the nail tech will continue to use the buffers and the nail files and the cuticle nippers on every single client that sat in their chair, and before you knew it, everyone had this infection. So this is a bacteria infection, no longer a fungus or a mold. Here's a quick diagram of the nail. Sometimes we need a visual to help us to answer some of the questions that we may have on our exam. At the top on the left-hand side, we see our free edge, our nail plate, which is a junctional unit of the nail. It moves, functional, junctional. Lanula, remember half moon or luna in Spanish, lanula. Cuticle. Above the cuticle, we have the eponychium, which is not on this chart here. The mantle, we have the matrix, which is the live part of the nail bed, that's where our blood vessels and nerves are located. We have the nail wall, the nail groove, and the hyponychium. Do you remember where to find that hyponychium? Nail diseases. Any nail disease that shows signs of infection or inflammation, redness, pain, swelling, or pus should not be diagnosed or treated in the salon. Medical examination is required for all nail diseases, and any treatments will be determined by the physician. Onychia. I think of a chia pet or chia seeds. They expand in liquid and shed fat if anyone's into supplements. Onychia is an inflammation of the nail matrix followed by shedding of the natural nail plate. Improperly cleaned and disinfected nail implements can cause this and other diseases if an accidental injury occurs. With these nail diseases, also you want to cross off what looks alike, like all the anis, cross that off. If you see chia or OSIS or SIS, try to find a smaller word or letter in the word or in the term and relate it to the definition. ONYCHOCRYPTOSIS. You're going to cry if you have something like this, also known as ingrown nails. Can affect either the fingers or toes. In this condition, the nail grows into the sides of the living tissue around the nail. The movements of walking can press the soft tissues up against the nail plate, contributing to the problem. Cry is highlighted. You're going to cry if you see something like this, or you're going to crip, so CRYPT, crip along the way, looking crippled because your toe hurts. ONYCHOLYSIS, L stands for lifting, is the lifting of the nail plate from the nail bed without shedding, usually beginning at the free edge and continuing towards the lanula, resulting of physical trauma, injury, or allergic reaction of the nail bed, and less often related to a health disorder. Often occurs on natural nails when filed too aggressively, on nail enhancements when they are improperly removed, or on toenails when clients wear shoes without sufficient room for the toes. ONYCHOMADESIS. I'm mad because my man gave me a severe systemic illness, so we separated and fell off. So when you're mad at somebody, don't you separate and fall off from them? ONYCHOMADESIS is the separation and falling off of a nail plate from the nail bed. It can affect fingernails and toenails. In most cases, the cause can be traced to a localized infection, injuries to the matrix, or a severe systemic illness. Drastic medical procedures such as chemotherapy may also be the cause. Nail psoriasis, I have sore highlighted. So when you have a scab or sore, doesn't it feel rough and it has tiny pits? Is a non-infectious condition that affects the surface of the natural nail plate, causing tiny pits or severe roughness on the surface of the nail plate. People with skin psoriasis often experience this nail disorder. Neither skin nor nail psoriasis are infectious diseases, can also affect the nail bed, causing it to develop yellowish to reddish spots underneath the nail plate called salmon patches. Paronychia, I hear around, is a bacterial inflammation of the tissue surrounding the nail. Redness, pus, and swelling are usually seen in the skin fold adjacent to the nail plate. That looks like it hurts too. Individuals who work with their hands in water, dishwashers, and bartenders, or who must wash their hands continually, are more susceptible because their hands are often very dry or chapped from excessive exposure to water, detergents, and harsh soaps. Pyogenic granuloma. I hear granola or granules. I chose granola. Lumpy. It's a lump and it looks like it hurts. Is a severe inflammation of the nail in which a lump of red tissue grows up from the nail bed to the nail plate. Onychomycosis. My nail has a fungal infection and I need to see a physician. Is a fungal infection of the natural nail plate, whitish patches that can be scraped off the surface of the nail, long whitish or pale yellowish streaks within the nail plate. The free edge of the nail can crumble and may affect the entire plate, often invade the free edge of the nail and spread towards the matrix. Tinea pedis. Can we all agree that this is athlete's foot? Is a medical term for fungal infections of the feet, can occur on the bottoms of the feet, often appear as a red itchy rash in the spaces between the toes, most often between the 4th and 5th toe. Over-the-counter antifungal powders can help keep feet dry and may speed up healing. Another way to remember this is pee. Back in the day, before they came out with antifungal creams and powders, you were taught to stand in your own urine or your own pee to get rid of athlete's foot or to calm down the red itchy pain that you will feel at the bottom of your feet. Tinea pedis. Let's keep in touch. If you have any additional questions about nail diseases and disorders, I can be reached by text at 817-804-6704, or you can email me at kellyg@ogleschool.edu, or DM me on either one of my social media platforms.